to Behind a Smile. I am Dr. Chantal Ambrose, and I am a dentist. I host a healthcare business podcast where I interview healthcare practitioners around the world, sharing tips on how to improve your healthcare practice, innovate, and grow while living your best life. We share products and information from healthcare partners that can help you in your practice journey, be it a startup, a family-based business, or a multidisciplinary healthcare team. Most of the information provided here is based on personal experience and opinions, so please supplement what you learn here with approved research studies and professional advice. Thank you to everyone who has subscribed, and I invite you to join our community if you haven't. We would love to hear from you. If you would like to be on the show, drop me a mail at behindasmile2@gmail.com. Let's make it happen together. So hello everyone, it's Chantal once again, and I am very excited to present to you Dr. Chelsea Cahi. So we're excited to have her in the studio today. She's been absolutely gracious to give us a little bit of her time, and she's a busy lady. So I just want to introduce her before we get into the nitty-gritty for today. So she is a graduate from the University of Witwatersrand, and she managed to get the Dean's Golden Key Award for Academic Excellence. She's completed her year of community service, and then Chelsea joined her dad and her uncle in Cahi dental and prosthetic practice in Parktown North. So I'm really excited to have somebody talk about orofacial pain, TMJ management, what we're able to do with that, and a little bit about her other love, which is peds. So we welcome you, Chelsea. Thank you for being here today.
Thank you so much. I'm so excited to be on this podcast. So thank you for having me.
I want to know, what is it like growing up in that atmosphere? You not only had dad as a dentist, but you also had your uncle as a dentist. And can you just share with us, what is that like growing up in this dental business that's a family business? And how did that influence you and your career path?
So growing up in a dental world, you could almost call it, it didn't really have much influence on me until I was around 16, when I was thinking, what am I going to do with my future? I always wanted to do something medical. It was a non-negotiable. I just wanted to do something like that. And when I was about 16, my mom actually said to me, Charles, maybe you should consider dentistry. You should go and shadow Dad and Uncle Emil and have a look at it. It's a wonderful profession, especially for a woman. Your hours are flexible. And I hadn't really thought about it up until then. And then I started shadowing them, and to everybody's surprise, I actually enjoyed it and found it quite rewarding. And that's when the whole journey began. And it's been absolutely wonderful. I couldn't have asked for a better support than my dad and my uncle during my studies. Really, they helped me tremendously. And I actually felt only when I really joined the practice after my degree is when the true learning actually began, because I have learned so much from them post-graduating that it's actually priceless. And to be together is wonderful. I mean, people ask me every day, how do you work with your father? Family business can be tricky. Don't you guys clash? And I always joke around and say, he drives me mad. That's just because he's my dad. Not because he's my boss. I mean, you couldn't wish or ask for a better boss or an employer than my father. But, he drives me mad because he's my father, and he's on my case all the time. Also, luckily, we've all got different interests in different fields. So our work doesn't really clash, but it's a great environment. I love it. I couldn't ask to be part of a better practice. And I'm just very lucky and fortunate.
Sure. Listen, I think that we've spoken on the show. I put a lot of emphasis on mentorship. And I find that it really is something that in your undergraduate year, you'll find that there are a few individuals that have almost a background with their mentorship. And then there are a few individuals that are seeking the mentorship. And then there are a few individuals that are just really just finding their feet.
Yeah.
And I've been encouraging, since having the podcast, I've been encouraging us as professionals, as healthcare professionals, to start looking at mentorship as not something that is competitive, but it as something that can really grow individuals and practices and people at large. So it's exactly what you've said earlier, you could not have somebody better than your own dad because your mentorship starts so young. You have an expert in almost every field in dentistry, and you do a significant amount of aesthetics as well. So what is your focus in the practice?
So I practice general dentistry, and so there isn't one aspect that I don't do. I mean, I see all my general dental patients, but I think you could call my niche is maybe two aspects. Peds, definitely. I've managed to build up quite a solid foundation of pediatric patients. And I also do quite a lot of TMJ management. A few years ago, I actually did a fellowship with a maxillofacial surgeon in Rosebank. He subsequently immigrated to America, and he specialized in TMJ and oral facial pain. And I learned a hell of a lot from him. And so I've almost implemented that now into my practice. So I do that. I also do a little bit of non-surgical facial aesthetics, nothing major. I'm very conservative, but I do it, as well as just the general implants, things like that.
There are a few aspects that I'd love to touch on. So I'm excited about TMJ and what people are doing in terms of management. So can you give us a little bit of a background with what you're doing with TMJ?
So usually, I mean, South Africa or just every day, I mean, we live in a very stressful environment. And I mean, it must be every day or every second day, we're seeing somebody in the practice that's coming in and presenting with pain or tenderness in either their jaw joint itself or the muscles around the jaw. People are waking up with headaches. They're struggling to fall asleep, struggling to stay asleep, have tightness in the jaw, just that general sense of feeling unwell and fatigued. And a lot of the time, a TMJ problem is misdiagnosed, and people think it's just head and neck tension, or it's earache, or it's sinus pain, or it's a nerve problem. So you really have to be quite on the ball to get it right. And when we do get it right, it is rewarding. It's a difficult thing to manage because we try to keep our management conservative, depending obviously on how severe it is. Yeah, we try really hard just to get these patients out of pain. A lot of the time with TMJ, it's irreversible. So once it's already in the jaw joint and people are hearing like a clicking or there's a slide or something along those lines, it's almost irreversible unless you want to go and have surgery, which a lot of people don't. And then we just try and manage the symptoms and manage your pain and just try and improve your day-to-day life.
So are you doing any bite plates? And do you do this over a number of different sessions, or how do you structure that program?
So usually if I see somebody and they're suffering, obviously after we do an examination or consultation, depending on how bad it is, it is a process. I don't like to just throw everything at once because different things work for different people. And I like to see what's going to work and what's not going to work. For example, some patients actually require Botox or trigger point injections into those muscles to relieve that tension. But it's not my first line of treatment because, then if I do that and I give a bite plate and I recommend physio, then we don't really know what's working and what's not. So I usually start with a course of medication just to try and break that spasm for about 10 days. 99% of the time, I always encourage my patients to get a bite plate, purely just to protect their teeth, number one, and also just to try and break the habit of that constant clenching that they're doing on a daily basis. Because a lot of people think, oh, we only clench at night. But if you're clenching at night, you're clenching in the day. And people just don't realize that. So just to try and break the habit, I've got a great team of physios that I often refer patients to try and relieve that tension. And then if that's still not relieving their symptoms enough, that's when I start suggesting trigger point injections into the muscles to try and break that spasm.
Patients don't know enough about how these spasms can actually interrupt their quality of life.
Yeah.
And
Absolutely.
it's almost as though we don't have enough education out there. We just don't have enough information out there. And in terms of us being practitioners, we haven't really participated at that purposeful treatment level for the patients when we do find them. When I speak to some of our colleagues, they often say it's quite a difficult patient because they often don't believe that a spasm from your jaw can result in a headache, in neck strain, in a backache, in shoulders paining. They just think that it's a medically related condition that has very little to
Absolutely.
do with their teeth. And it's almost like you have to go to this idea of convincing them that it actually is the stress coming from a jaw and from a joint
Absolutely.
and for a long period of time. Because by the time they really present with that amount of pain, they've tried a lot, but they haven't tried what works because they just
Exactly.
have been lost in the system of pain. They'll go to the physio or they'll go to their medical practitioner and they'll get some sort of advice. I know a lot of patients that start at the chiropractor, and never are advised to go and see the dentist. A really great thing to do is ask the patient to go and maybe consult with a dentist that is looking at TMJ, where they may be able to assist with that pain and may be able to find those trigger points. And really, we could work together in collaboration for something that could really help patients. So, congratulations on that.
Thank you.
Now, listen, I've been involved in peds for a long time. I have postgrad in pediatrics, and it's one of my special love jobs. I think you either love it or you don't.
Yeah.
I work with my husband, and he's a guy that I think that he's just been blessed in that he can do great surgery, and he's one of the few men that I know that can actually work on children with patience. So I don't know how you get everything in life. I want to know now, how did you get into that? I call it a little micro speciality. And those of us that are highly pedantic in the field and that listen to me, you have to forgive me, but I feel like it does, even though we don't get regarded as specialists, what we do is very specialized. And I'd love to hear how you got onto that journey and what led you there and how's it all going.
So I've always loved children. I have a huge love for children. I come from a very big family, always been lots of little kids around me. So I think it's almost come naturally to me to deal with children. When I was studying our pediatric course, I mean, we weren't overly exposed to too much clinical work, but I did used to enjoy it a lot. And when I qualified, I actually joined the Prosthodontic Society of South Africa, where I headed up the outreach component of the society for a few years. And that's when my love for pediatrics really started, because I used to set up clinics and we used to do free dental care to a lot of underprivileged children all around Gauteng. And then we've always had a lot of children coming to the practice. I mean, my dad's very good with them and they love him. And then when I started, I think my dad almost not lost his patience, but I think he saw that the kids maybe preferred me. I think because when they see a young female, it's less daunting to them than seeing this big man in a white coat. And that's sort of just how I got into it. And obviously, I'm in the space now. A lot of my friends and colleagues have children and they start bringing them to you, I often go to schools and give talks to the kids. And I just always try and relate to them. And I think that's a huge thing, just to try and relate to the kids. And now it's almost like I've got all these little friends, that I wouldn't really say they're my patients. They're just my little companions that I see every 6 months. And I love it. I mean, it's stressful, don't get me wrong. And it can be incredibly frustrating, because what will take you 15 minutes to do on an adult can take you 45 minutes to do on a child. And if the parent is neurotic and anxious, then that's a whole other ball game in itself. But when you get it right, it's great and it's very rewarding, and it's definitely adds sunshine to my practice, I think.
Oh, well, it's very special to do. Like I said, well, I'm slightly biased because I've had a special interest in it for a really long time. Nobody wanted to see children as a special interest because it took so long to do to a little person what you could do in a really short time to an adult. And
Absolutely.
and did take growing the fraternity, getting more information out there. The Paediatric Society has been absolutely instrumental in South Africa to be able to give us a little bit more assistance with knowing how to treat children better from a worldwide perspective, because we're going to be having IAPD here in Cape Town soon. So I really, really think that the more kids that we are able to help, the better we can control disease. So when you go out to schools, I'm sure you're giving a lot of information out, but I also know that as a practice that you guys offer a lot of philanthropy. And I want to hear a little bit about that because it's very special. And I think that
So we've always been a practice that firmly believes in giving back. And it's not really something that we like to advertise too much because we feel that it's not necessary. We like to keep it close to home. But about once a year or every year, we do adopt some kind of children's organization where we offer the children free dental care and treatment. Obviously, not all the work, but the emergency work that needs to be done. So all the children will have consultations and cleanings. We do fissure sealants. And then if any of the kids need extractions or fillings or pulpotomies, things like that, we do. And we just try and educate them and promote dental awareness, promote oral education. And a big part in it is actually educating their caregivers, because these kids that we see are young, they're little. Some of them are as small as 2 years old. So it's not, we can't educate them and expect them to know everything. So it's always about that point of educating the caregivers. And we also, we must see maybe 3 or 4 patients a week where my dad does it pro bono. He doesn't charge patients. He will never turn anybody away. He's definitely instilled that in all of us. It's part of our mission statement. If somebody's in pain or they're suffering, under no condition do we turn them away, and we try and help people as much as we can. We're lucky and we're blessed that we do have such a wonderful and thriving business, but we don't turn anyone away, even if patients can't afford a full private rate. We do always try and compromise in some way. So it is something that we love and it's close to our hearts, and please God, we can continue to do this.
And so I really applaud you and I applaud the business at large for being able to really commit to it. It's a real commitment when you have to see children and there's quite a few of them. Plus, what you say is it really shows how much of pediatrics you do, because the caregivers they are the guardians for those children, and they make the decisions for them. Often the children are not in a position, even as they grow older, to make their own decisions.
Absolutely.
And to educate them really does get you to that point of being able to change lives. So very well done for your commitment, your annual
Thank you.
commitment to, and I love the idea that it's done with such a lot of grace. I know that it's not something that's publicized too much. You keep it to yourselves, and it's something that's in keeping with, I think, the grace and the incredible integrity with which you are presenting the philosophy of health. It's an old school idea, and I think that it's part and parcel of what I see as your mission statement, as your business offering, and as your family profile as a business. Now, I know that your uncle, Emil, does a lot of prosthodontic work. I always like touching bases on the family at large, as well as your mom. I know your mom plays an important role in just keeping everyone together and just, I think, sewing the seams of the Cahi fabric. And she does that really very well, even though she doesn't often need to be in the spotlight about it. I touch base on that. But I think that it's really something that all of us that want to move towards growing our practices, you put out there a lot of really great information. You stand by what you do. When things go wrong, you also talk about it, you know. And I
Absolutely.
really respect that. I really respect that. I revere that because we don't often talk about the things that go wrong, but they go wrong.
Absolutely.
And, you know, as dental professionals, as healthcare practitioners, we often have our backs up that, listen, this didn't go ideally. It didn't go according to plan. But I can tell you, in my 20 years, and I'm a speaker for dental protection, not everything has gone right. We, just by being able to speak to each other as a fraternity rather than as just being able to see each other as competitors, I really enjoy that level of integrity. It's something I applaud every single person that's put themselves out there in that situation. Now, we're going to talk about the hard stuff because on the podcast, I talk about hard stuff. And as we go on, as you know, our podcast was born from the fact that post COVID, many practices actually went bankrupt. You know, to get back on that, on being able to be busy and to be able to afford the busyness that years and years has given you reference to, we've had to start, many people started from scratch all over again. And I find that people are finally finding their feet. Despite the way the economy is looking, they're finally finding their feet in South Africa in healthcare. What I do want to talk about is as we're growing and as we're diversifying, there is this competition that we're finding amongst our healthcare. And I want to ask you, you're such a well positioned practice. You must be seen by other dental practitioners, other healthcare businesses, as being one of those people that are taking market share. How do you respond to these competitive behaviors now from colleagues? Some of them are advising our patients, to go and seek sort of litigation, and inadvertently they try to gain those patients. And, this does happen in every industry. I'm not only talking about healthcare. So how do you respond to these competitive behaviors? Because you, for a really long time, are part of a business that has withstood the test of time. You would have gone through the waves, and this would not be the first, and it certainly won't be the last. But how do you respond to this? What advice do you have to us as practitioners who are still early in the game? Yeah.
Sure, that's a question, and it's a hard question, but it is something that we all go through. I mean, I don't think there's one healthcare professional that can say they haven't experienced some sort of professional jealousy, if you may call it. And also, I don't think that there's one healthcare professional that can say that they haven't had a complication, because we all experience these things. I mean, I'm sure everyone in their life that's taken out a tooth has experienced a dry socket or something along those lines. Things happen. But in terms of how I deal with these sort of, say, professional jealousy or our colleagues acting the way that they act, to be honest, lucky I haven't experienced it myself, but I have seen substandard work from other colleagues. We all have. I don't think anyone has seen something from someone else in their career and it hasn't been great. But I think there's absolutely no excuse to run down a dental professional or a fellow colleague of yours. And I think people need to remember the Hippocratic Oath that we all took when we graduated, and that being ethical and having an ethical practice is far more important than having a busy practice. And I'm quite big on that, and I'm quite solid when it comes to that. And even when patients request certain things, if I feel that it's not ethical and it's not the right thing to do, I won't do it. And if they want to go elsewhere to a practice somewhere else that is going to do it, then they must. But I like to sleep comfortably at night knowing that I'm doing the right thing. And I mean, if I see something from a colleague of mine that is substandard, I'm more likely to pick up the phone and phone them and discuss it with them, And I will never say to the patient, oh, yeah, this person did that. They should never have done that. Well, lucky you came to Cahi Dental. I mean, I just don't think that it's ethically right at all. But everyone to each to their own. And I just think people just need to remember that if you're ethical and you practice with dignity and you have integrity, the people will come. People want to see an ethical practitioner, and the business will come and money will follow. But your reputation is everything. And that is one thing that I must say my father's instilled in me, is that money comes and goes, people come and go, but your education and your reputation is something that nobody can ever take away from you, and it will follow you wherever you go. So you need to always carry on learning, carry on your education, but also make sure you keep a good, clean reputation, because that's something that once there's a mark on your reputation, can stay with you for life.
I appreciate that, because these are hard things, but those tips are really the baseline of integrity. And I think it does see you through in terms of a long and really a rewarding career, which I think all of us signed up for when we first started up and we had our dreams initially. I'll tell you when I was humbled and when I reached a point of knowing for sure that you can never judge another practitioner is I was quite early on in my business, and I had completed my dip in pediatrics, and I had been referred a patient that was sent as uncooperative, and they had fillings in their mouths, and all of the fillings were not great, sort of falling to pieces. And they were charged for it and whatever. And so, you hear these two perspectives. You hear the patient's perspective, you hear the doctor's perspective, and you're just there to somehow mediate that and try to move them in the right direction. And it was the most humbling experience when they sat in that chair. And I promise you, it took me close on to an hour and 45 minutes to do 3 fillings. And I thought to myself, I don't consider myself a particularly bad clinician. But on a scale of 1 to 10, those were the hardest fillings I've ever done.
I'm telling
That
you.
was, uncooperative was, I think, a really lovely way of putting it.
Sure.
It was just so much more. The child gagged. There was such a lot of saliva. If we were trying to suction, they got scared of the suction. The mum is sitting with the child in the chair, so there wasn't enough space for you to work in. And it humbled me, because when you look in someone's mouth and you're thinking that just happened because you had a lovely rubber dam that somebody tolerated, and they tolerated everything else that needed to go with a beautiful, perfect filling without any complexity. Those are the best days that you can get. And they, for me, remain my luckiest days.
Absolutely.
And so what you're saying is really so significant. But for us just to be able to practice with a level of integrity is a tremendous thing. And I think it still keeps me happy in what I do, no matter how hard the days get. And I will say that dentistry is one of those hardest careers that anyone could choose.
Absolutely. And it's so much more than just the mouth. I see patients, I look on the day sheet and I see this, and I start getting anxiety because I'm anticipating that it's going to be so difficult. It's like, oof, it's a bit of a difficult patient and they're very anxious, and I've got to do this filling right at the back of the mouth, and I don't know how I'm going to manage and this. And then it's actually my uncle Emil, who's a prosthodontist. He actually said to me, you know what? You just got to do it. Don't think, just go. When the patient sits down, just do it. Block everything out and don't worry about anything else. And that probably was one of the best advice he's ever given me. And now I try to just say, well, I've got no other option. No one else is going to do it. I've got to do it, and you just do it.
Listen, we have our daily stresses, and I want to know what keeps you looking so beautiful, so ready to go, with this beautiful attitude that it's a can-do attitude. You have a positivity about you. What are your daily stress reducers?
Probably definitely exercise is my biggest thing. I try and exercise every single day. If it's not a HIIT class, I try and do a Pilates or a bar class. I play tennis at least once a week, and I love paddle. That's a huge thing. And then I just try and when I leave work, I leave work. I try not to bring that stress home with me. And it has been a problem in the past because I am that kind of person that absorbs everybody else's stress and then it feeds into me. And I've really had to work on that. But yeah, I've learned to just leave it all behind and say, oh, I'll have to deal with it tomorrow or the next day. And then just spending my free time with people that I love the most in my life, and my godchildren who are just everything to me, and my family and my friends, and also just being outside is a huge thing. I know, maybe just going for a small walk and things like that. And I mean, when worse comes to worse, then I just tell my father he must see the patients and leave me alone. That's probably stress reliever, is having him there.
We must say that if you have that backup person, it really does help. There are days where even you yourself, you just need a little bit of a breakaway. Where do you see dentistry in SA?
Sure, that's a very loaded question because, I mean, I suppose it goes hand in hand with where we see SA in the future. But I still believe that some of the best medical and dental professionals in the world have qualified from South Africa. And I think that dentistry in South Africa has got a long future ahead of it. I mean, everyone needs a dentist. I mean, if you've got a sore tooth, you can't fix it yourself. You have to see, you can't go onto Google and find what must you do. People need a dentist. And about 2 weeks ago, my dad actually visited Wits and he went to see the new oral health department. And he actually was completely blown away. He said, it's amazing. It seems like there's great technology, a great space for learning. And so I think that dentistry in South Africa has got a long way. I think we're very much up there with the trends and technology and new things that are up and coming. But I just hope that we can just get this country under control so we can regain that worldwide respect that we've always been known for. But please, God.
Yeah. I'm so grateful for your time. Thank you.
Thank you. Thank you so
Congratulations, and keep on doing what you're doing. It's fantastic.
Thank you so much for having me. It was great. I was very excited to be part of the show.
Have you ever wished you could be rubbing shoulders with the best just to get through your worst? Never get the promotion and exceed the requirements. Join us to hear about strategies to build your brand, diversify your business, pursue your career passions with job crafting, and self care for healthcare practitioners. Hear about great products that can help you to get to where you always wanted to be. So remember, you are heard and you are seen, and on this platform, you are absolutely invited. Let's make it happen together.